Down syndrome or trisomy 21. It is the most common chromosomal disorder. Down syndrome or trisomy 21 is the most common chromosomal disorder. Karyotype is trisomy 21 type. Trisomy 21 type. This is 47XX. One extra 21 chromosome is present. Okay, this is the most common karyotype. Trisomy 21 type, that is 47XS XX plus 21. This is the most common type. Translocation type, karyotype, Robertsonian translocation. Robertsonian translocation of the long arm of chromosome 21 to another aerocentric chromosome, example 22 or 14. Robertsonian translocation. Robertsonian translocation of the long arm. Robertsonian translocation of the long arm of chromosome 21 to another acrocentric chromosome, chromosome 22 or 14. Robertsonian translocation of the long arm of chromosome 21 to another acrocentric chromosome, example 22 or 14. Mosaic type. Mosaic type is 46XX slash 47XX plus 21. Karyotypes are of three types. Trisomy 21 type, which is most common, translocation type, and mosaic type. Mosaic type means 46XX or 47XX plus 21. Okay. Translocation type means Robertsonian translocation of the long arm of chromosome 21. Robertsonian translocation of the long arm of chromosome 21 to another acrocentric chromosome, example 14 or 22. Mosaic types means some will be 46XX, some will be 47XX plus 21. Risk factor is increased maternal age. Down syndrome का risk factor is increased maternal age. Genetic alterations. Meiotic non-disjunction of chromosome 21 in the ovum. So the genetic alteration is meiotic non-disjunction of the chromosome 21 in the ovum. Meiotic non-disjunction of the chromosome 21 in the ovum. Meiotic non-disjunction of chromosome 21 in the ovum. Clinical presentations of Down syndrome. Flat facial profile, oblique palpebral fissure. Flat facial profile, oblique palpebral fissures, epicanthic fold, several severe mental retardation, gap between first and second toe, hypotonia, simian crease, abundant neck skin, brush field spots or speckled iris. So Down syndrome, trisomy 21. It is a genetic disorder caused by the presence of extra copy of the 21 chromosome. Extra copy. It is characterized by intellectual disability. There is severe mental retardation, Then the facial features are flat facial profile, flat facial profile, and oblique palpebral fissures. The facial profile is flat, palpebral fissures are oblique. There is epicanthic fold, gap between the first and second tone, hypotonia, simian crease, abundant neck skin, and brush field spots or speckled iris. Yeah, it is associated with congenital heart diseases, acute leukemias, Alzheimer diseases, and severe infection. Down syndrome or trisomy 21 is associated with acute leukemias, ALL or AML, Alzheimer's disease, severe infection, and congenital heart disease like atrioventricular septal defects. Down syndrome is associated with cardiovascular diseases, congenital heart disease like atrioventricular septal defect. Atrioventricular septal defect, this is a congenital heart disease. It is also associated with acute leukemias, ALL and AML, with severe infections and Alzheimer's disease. Associated with congenital heart disease, acute leukemias, severe infection and Alzheimer's disease. Down syndrome is associated with congenital heart disease, that is atrioventricular septal defect. It is associated with acute leukemias, ALL or AML. It is associated with Alzheimer's disease and severe infection. Diagnostic test during pregnancy. Triple test. Triple test में decreased AFP, decreased estriol and increased HCG. Triple test means decreased AFP, decreased estriol and increased HCG. Triple test में there is decreased AFP, decreased estriol, AFP or AST will be estriol. AFP and estriol will be decreased and HCG is elevated. Then another diagnostic test, chorionic villus sampling and amniocentesis. Chorionic villus sampling and amniocentesis. So trisomy 21 or Down syndrome, it is the most common chromosomal disorder. Trisomy 21 or Down syndrome is the most common. It is the most common chromosomal disorder. Karyotype 3 types, trisomy 21 types, translocation type and mosaic type. Trisomy 21 type means 47XX plus 21. This is the most common type. Translocation type includes Robertsonian translocation between the long arm of chromosome 21 to acrocentric chromosomes like chromosome 22 and 14. Mosaic types include 46XX and some with 47XX plus 21. The pre-risk factor for Down syndrome is increased maternal age. Genetic alteration means here is the meiotic non-disjunction of chromosome 21 in the ovum. The genetic alteration is meiotic non-disjunction of the chromosome 21 in the ovum. Meiotic non-disjunction of the chromosome 21 in the ovum. Clinical presentation: flat facial features, flat facial profile, oblique palpebral fissures, epicanthic fold, severe mental retardation, gap between the first and second tone, hypotonia, simian crease, abundant neck skin, brush field spots or speckled iris, brush field spots or speckled iris, associated with congenital heart disease like atrioventricular septal defect, acute leukemias like AML and ALL, acute leukemias, Alzheimer's disease, and severe infection. Investigation involves triple test: decreased AFP, decreased estriol, and increased HCG, decreased ECG, decreased AFP, decreased estriol, and increased HCG. ट्रिपल टेस्ट में AFP कम होगा, HCG ज़्यादा होगा. AFP कम होगा, एस्ट्रायोल कम होगा, HCG ज़्यादा होगा. ट्रिपल टेस्ट मीन्स decreased AFP, decreased estriol and increased HCG. Then other diagnostic test during pregnancy: chorionic villus sampling and amniocentesis. So Down syndrome or trisomy 21 is the most common chromosomal disorder. Karyotype: first is the trisomy 21 type, that is 47XX plus 21, which is most common. Translocation type: Robertsonian translocation of the long arm of chromosome 21. to other acrocentric chromosome like 22 or 14. Mosaic type means some will be 46XX, some 47XX plus 21. The risk factor is increased maternal age. Genetic alteration involves the non-disjunction, meiotic non-disjunction of the chromosome 21 in the ovum. Clinical presentation: facial profile is flat facial profile, oblique palpebral fissures, epicanthic fold, oblique palpebral fissures, epicanthic fold, severe mental retardation, gap between the first and second toe, simian crease, hypotonia, abundant neck skin, brush field spots or speckled iris, brush field spots or speckled iris, flat facial features, oblique palpebral fissures, epicanthic fold, severe mental retardation, gap between the first and second toe, hypotonia, simian crease, abundant neck skin, simian crease, abundant neck skin, and one spot that is brush field spot, flat facial features, oblique palpebral fissures, epicanthic fold, severe mental retardation, gap between the first and second toe, hypotonia, simian crease, abundant neck skin, and brush field spots or speckled iris. Down syndrome is associated with congenital heart disease like atrioventricular septal defect, Alzheimer's disease, and then A for acute leukemias like AML, ALL, and severe infection associated with congenital heart disease, atrioventricular septal defect, then Alzheimer's disease, acute leukemias, AML or ALL, and last it is associated with septic infections. Diagnostic test during pregnancy is triple test, जिसमें decreased AFP, decreased estriol and increased SCG is there. Then other diagnostic tests during pregnancies are amniocentosis and chronic villus sampling. Chronic villus sampling and amniocentosis.